can be so hard being a woman right now, right? I guess not just right now. Right now, we have a lot of external influences that make it really challenging to be a woman if you're thinking about reproductive rights and things like that. But we also historically throughout history have faced a lot of challenges. Today, I'm going to focus on some of the biological challenges that us women face and how that can impact our sleep. So, hi, my name is Dr. Jessica Meers. I am a board certified sleep psychologist, and I am here to give you information about your sleep and so you can learn how to sleep better. Okay, so what are the challenges that women face biologically and how does that impact our sleep? We have cycling hormones, reproductive hormones in our bodies that do amazing things like make us able to grow and deliver babies, and that is awesome. But those patterns of hormones change month to month, but also in different kind of key time points in our lives. And those changes really can impact our whole well-being, but today I'm going to be talking about sleep. So some of the hormones, and these are just two of many, but the two biggest players are estrogen and progesterone. So you might know these hormones, they're really, they change throughout the menstrual cycle. So estrogen is really high during the first half of our menstrual cycle, and progesterone is really high during the second half of our menstrual cycle. These hormones are really dynamic, meaning that they're changing all the time. They go up and then they go down. And when those hormones change, they impact our ability to sleep. So estrogen is thought to be really protective of our sleep. We tend to sleep better when estrogen is dominant in our systems. And so we tend to have more restful, protected, restorative sleep. Whereas progesterone is a little bit more finicky. In large amounts, it can make us feel really sleepy and drowsy. But in the amounts that are changing across our menstrual cycle, it actually raises our core body temperature. And that rise in our core body temperature can make sleep feel more fragmented and disrupted. And so that's why it can be so difficult to kind of track these changes, because there's complexity to the cycling of these hormones. So that could mean disrupted sleep in the days leading up to your period if you're naturally cycling. Oftentimes, the increase and then the sharp decline in progesterone and estrogen can make it really difficult for us to sleep. And then these same hormones change when we get pregnant. So estrogen and progesterone increase dramatically, which is one reason why we might feel really drowsy during pregnancy. But also it supports a growing fetus, which then can make it really hard for us to maintain sleep during pregnancy. These hormones are surging during that time. And then postpartum, they're declining rapidly. And then we get to menopause. And sometimes women feel like they hit menopause and all hell breaks loose, especially when it comes to their sleep. These hormones are shifting kind of radically. And so we're very prone to insomnia and bouts of being completely unable to sleep, fragmented sleep, never mind hot flashes that can disrupt our sleep during the middle of the night too. So what do we do about it? Well, I'm going to be talking over the next couple weeks about the intricacies of these sleep problems in women. But by and large, everything that I've talked about previously still stands, which means to keep a really consistent sleep-wake cycle. So go to bed at the same time, get up around the same time every morning, because that's going to help protect you against these changes causing long-term insomnia. So we want to make sure that we are following good sleep hygiene practices, and we know it's going to be challenged, like right before our period starts or during pregnancy. We want to prioritize these routines even further because we're going to be more vulnerable to sleep disruption. So Protect your sleep, stay really consistent if possible, but also be kind to yourself if you are noticing difficulty sleeping. Usually they're short-lived if we don't overreact and get really inconsistent with our sleep schedule. And do whatever you can to keep yourself sleeping well. So make sure that you're not having really emotional discussions right before bed, no arguments right before bed. Make sure that you are keeping your room dark and cool and comfortable, especially in those weeks before your period, or especially if you're going through menopause. And ask that others respect your sleep as well. Keep noises down, keep lights down. It is really important that we are sleeping well so that we can face the challenges that we all experience in life, particularly now. So stay tuned. I'll be describing more changes in sleep as it relates to women. So I'll see you next time.